So a little bit about dermatology is basically, it's a field of medicine that studies the largest organ of the body, which is the skin. And it's really great because we deal with not only babies or newborn infants, but all the way up during the teen years when we're dealing with acne, and throughout all the way up to adulthood. So I have my youngest patient being a 1 day old in the NICU, and I have my oldest patient being a 104-year-old gentleman that served in World War II. I think in dermatology residency, we're finding what we call in medicine the zebras, sort of the atypical things that come out that not a lot of people have. But I think that's important during residency to know and be exposed to all the atypical things that could happen in dermatology. But what I would see in my daily clinic is what we call the horses. So a lot of acne, a lot of mole checks, a lot of fungus. So I think that was a little bit interesting when I started practice of, oh wow, I am not seeing the Merkel cell carcinomas, I am not seeing the generalized granuloma annulare or the mycosis fungoides. What I'm actually seeing is acne, warts, and moles most of my day. Basically, you've decided you want to be a doctor, and now what? So I think it's important to know that if you're a visual person, that dermatology is actually an incredibly visual field. And it's one of those fields that really is dependent on whether you're a visual person or not. So if you're a photographic learner, which I happen to be, it's incredibly helpful and can really expedite your career. So I think number one, knowing what kind of learner you are. So if you're a photographic learner or a visual learner, it's important. Also, to be able to be fast on your feet. In dermatology, we see patients every 15 minutes. So we're known to see about 30 patients a day, and some people even see up to 50 patients a day. So that's a lot of patients. And it requires a lot of patience because you're in and out of rooms and you're seeing, some people for skin cancer, other people for a rash, some people for acne, some people for cosmetic things, other people for toenail fungus. And you really just got to be, on your feet. And, I think that's sort of one thing is you got to be fast. You have to sort of be tireless because unlike my husband, who is an anesthesiologist, so I think he's getting the butt of a lot of my jokes today because he's not here to defend himself, but basically all of his patients are asleep, count backwards from 10. So for us, on the other hand, we're on our feet all day long and we're going between rooms and we're seeing completely different stories and completely different rashes and really having to investigate what's going on with our patients in a very short amount of time. I do have to tell you that when patients first come in, I feel like they've been almost through the mill. They have seen so many different people, internal medicine doctors posing as dermatologists or estheticians or facialists or, a long layer of people that weren't necessarily always as qualified as they should have been to treat these patients. So I think a lot of times when I get patients through my door, it's a lot of education going on, a lot of educating patients of, this is what we want to do and this is why we want to do it. So I think that's a lot of what goes on in those 15 minutes in the room. As early as yesterday, I went and saw my hematologist and he said, oh, so how's dermatology going? Can you get me some Botox next time you come in? And I think a lot of that is, disheartening because, even doctors think that dermatology, all it is Botox and fillers. And, I think that, that it's true. We definitely do. I would say about 25% of my practice is cosmetic dermatology, but there is a vast majority of my practice is not. And I think despite, all the med spas opening up and having nurses and PAs and different people who don't have, necessarily the extent of training that they should have to be doing these kinds of procedures, performing them, I think that's when it comes to, becomes more real of, oh no, as a dermatologist, we really need to make sure that we're doing things properly. Even as close as my husband, who is an anesthesiologist and is a doctor, used to tell me, oh, well, aren't you just a pimple popper? Or there's 2 creams that every dermatologist uses for their entire career. One is a steroid cream, one is an antifungal cream. So we are the butt of a lot of jokes, I do have to say. But, on the other hand, I'm so confident that what I do makes a difference in patients' skin. And, I do have a fellowship in melanoma. And yes, despite popular belief, I did go to medical school. So, I feel very comfortable in what we do. We are the specialists in the skin, which is the largest organ of the body. And so there's a lot of skin cancers that we get to treat. And in particular, melanoma. A lot of people don't know that melanoma is the #1 cancer killer in women 25 to 30. And it's a spot on your skin. So to have a young woman lose their life because of a spot on their skin is really something that drives me every day. That if a patient does come in for just Botox or filler, I say, hey, have you had a skin exam in the last year? And at that point is when, things become more real. So an interesting fact about dermatology is it used to be called, up until 1969, dermatology and syphilology. So yes, we see a ton of STDs in dermatology, and I think a lot of patients are surprised by that, and a lot of people in general are surprised by that. I remember when I was in residency and I was chief resident of my residency, I would do a lot of lectures for the other residents, and I remember my husband walking into our home office saying, wow, I feel like every time I come in the room, there's a picture of a genitalia or groin or penis on the screen. What are you doing? And I told him, I know you went through medical school. A lot of dermatology training is STDs.